Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about sickle cell disease. This is show number 12 on sickle cell disease, and I'm wrapping the series up in this segment. Today, I'm speaking specifically about sickle cell trait. Now, there are worldwide 300 million folks who have sickle cell trait. In this country, there are 3,600,000 people with sickle cell trait, representing roughly 8% of the black community as well as 8% of the Latino community. The percentage is the same, carry sickle cell trait. The difference is that sickle cell trait, which is SA, which is half of the disease, as it were, is milder. A lot of the time, it doesn't cause any problem, but it has its own profile of problems, such as people with sickle cell trait can, of course, have low-grade anemia because between 30 to 35% of the red blood cells are sickling, like this banana-shaped half moon, about 30 to 35%. An individual with SS is the reverse. They have about 60%, sometimes 70%, those cells are sickling. So sickle cell trait is a milder condition. As a result of that, they have a low-grade anemia. And of course, they can also have arthritis. See, sickle cell trait also suffer from arthritis, severe osteoarthritis. Another condition that occurs very frequently is microscopic hematuria, that is red blood cell found in the urine. Now, for a reason that is completely not clear, people with sickle cell trait seem to have a propensity of bleeding, and the bleeding occurs most frequently from the left kidney. And the reason is because the left kidney anatomically is positioned higher in the abdomen. Because of that, the upper part of that kidney receives less oxygen. So the lack of oxygen on the upper part of that left kidney results frequently in what we call gross hematuria, as opposed to microscopic hematuria. And the gross hematuria is the result of sloughing off of the papillae. Papillae are structures that are inside the kidney, so you have what's called papillary necrosis. Now, again, for a reason that is not clear, to me anyway, people with sickle cell trait seem to bleed from the kidney more frequently than people with sickle cell anemia as such, the SS. Now, everyone with either SS, SC, or sickle cell, all of them have microscopic hematuria, which can represent a major confusing problem. Because when somebody presents to their office for the first time, you don't know them. If you did not do a hemoglobin electrophoresis, and frankly, I'm ashamed not ashamed, but I'm not surprising, I shouldn't be ashamed of that. I shouldn't be ashamed for stuff that other people didn't do, because they're not practicing cultural sensitive medicine the way they should. They don't do hemoglobin electrophoresis when they're just evaluating the patient for the first time. Either the patient is black, patient is Latino, the patient is from the Middle East, patient is from India, because there are a lot of sickle cell disease in the particular section of India as well. In fact, there are more sickle cell disease in India than you have here. Here we have 100,000. Well, India is a very, very big country, close to 1 billion folks. So you can well imagine, but they don't talk about that because people they don't talk about sickle cell anemia taking place in the Middle East either, because talking about it is an admission that this part of the world, these parts of the world have some connection to Africa, which is the most ridiculous thing anybody can think of, because the human race began in Africa. So what is the shame in somebody admitting something that all scientists and all highly educated persons, you don't even have to be highly educated, know that the human race began in Africa. So therefore, what is the shame in telling, you have no idea the millions of dollars that have been spent doing research in the laboratory to come up with another gene to explain why these folks have sickle cell disease, as opposed to the three well-known genes, which is the BAN from Benin, CA from Central African Republic, and SEN from Senegal. These are the three main genes that cause sickle cell disease, as we know it. So the billions of dollars are being thrown away doing research for the sole purpose of trying to identify another gene that is not connected to Africa that can cause sickle cell disease. Now, psychologically, this is a major issue. And I'm not here to say anything negative about anybody, but suffice it to say, as a clinician, scientist, and a teacher, I find it bizarre for folks to want to pass themselves for what they're not. But I guess if they have the money, they can throw it away. But God has the power. God created the world. God created the human race. If God wanted the human race to start in a different way, to start in a different part of the world, it would have done so. That's not what he did. He started the human race in Africa. So therefore, every single human being, regardless of what color skin that individual has, is African on the inside. And all scientists have to do is get a hold of specimen from that individual. He or she can be traced back to his or her African roots. Simple as that. That's been done. This is nothing new. This is basically old information, old science. It's been, in fact, the research has been done. It is amazing, really, but this is the world, and it's not going to change. The predominance of the Caucasian race in terms of having the bulk of the money, etc., have the bulk of the power, etc., etc. Everybody wants to be associated with it. Why not? That's the way psychologically people feel. That's their right. I'm not here to say anything negative about it. I'm just stating scientific, documented facts. Okay, so therefore, sickle cell trait is a worldwide disease now. Especially we're living in a world where there is intermarriages going on all over the place, multiracial folks all over the place, and the immigration situation, people migrate from one place to another. That is why when one is practicing clinical medicine, not medicine in the lab, you have got to have an open eye to who you're practicing medicine for, so that you don't miss serious medical conditions that they may have, because you blind yourself from realizing who they are. Okay, so the trait is SA. It is a disease. I'm going to give you the list. I'm going to go through the list of problems that are associated with it. Number 1, low-grade anemia. Number 2, microscopic anemia. Number 3, macroscopic gross hematuria. Gross hematuria can and does occur. Okay. Severe arthritis. And the arthritis is the result of lack of oxygen going through the bone. And therefore, the sickle cells get stuck in the bloodstream, resulting in occlusion, resulting in arthritis. As far back as 1960, there's an article in the Mount Sinai, believe it or not, hospital radiology. They must have had because I look it up, they must have had a journal. There's an article there describing arthritis and sickle cell trait as far as back in the 1960s. I was not in this country then. I was alive, but I was not in this country. I was not in medicine. So arthritis, when you're examining somebody who has arthritis, you check them for all sorts of other reasons why they have the arthritis. Well, sickle cell trait happens to be one of the most common cause of arthritis, severe pains, etc. Okay. Now, another thing that happens is the kidney. People with sickle cell trait in particular have an abnormality that prevents them from concentrating their urine properly. So when you check the urine specific gravity, it's likely to be always very low because they have that condition. All right? And of course, another thing that frequently happens in people who have the sickle cell trait also is the whole concept of the spleen. You have to understand that people with sickle cell trait have a spleen. Because of the spleen, there are certain conditions under which they can rupture the spleen. Okay? So, as a matter of fact, years back, when discrimination was blatant in the armed forces, blacks were not being accepted in the military using this sickle cell trait thing as a way of discriminating against them. They were discriminated against them anyway, but that was one of the things. I think there is a congressman from Michigan. I think he's still an older individual, but I think he's probably still in Congress. He had to fight in Congress to push a law through, I believe, to eliminate that nonsense law. There was a law, okay, and he fought against it, and I think he succeeded in removing that from the congressional record. I don't know when it happened, but I saw that a few years back. So all these things can happen. So having sickle cell trait is not a bargain. It's not as bad as having sickle cell disease, but it's not as a bargain now. The confusion can occur because the individual has nothing to do with that. They feel fine. They don't have any problem, similar to people who have the SS or SC on sickle cell. So they don't know anything about it, but they're carrying the gene. They're carrying the gene. So when they show up in the office, you evaluate them. You're likely to find a low-grade anemia, so you have to try to evaluate why the low-grade anemia. You do a lot of tests to evaluate that. Then you also find red blood cells in the urine, and quantity it shouldn't be there. So you spend a lot of money doing a lot of very important tests to make sure that these individuals don't have anything other than sickle cell trait. But if you do something as simple as a hemoglobin electrophoresis as part of your blood test that you're going to do when you just see the patient for a complete physical exam, right away you know that's probably what it is. But you still have to be careful, because just because the individual have sickle cell trait, they have microscopic hematuria commonly. That does not mean they can't have kidney stone. That does not mean they can't have cancer of the bladder. That does not mean they can have cancer of the prostate. That does not mean they can have cancer of the kidneys. So you have to rule all these things out. It has to do based on the age of the patient as well. If somebody 18 years old, they show up in the office, they have microscopic hematuria, the hemoglobin electrophoresis is positive, they have no symptoms of urinary tract infection, they have no other issues involving URI, any kind of sexually transmitted disease that is obvious, you pretty much rule it out right there. However, depending on the age, then you have to think about the person's prostate, you have to think about the bladder, because they can have any number of serious diseases that can result in them having blood in the urine. So you wind up having to do special tests, an ultrasound to make sure the kidneys are fine, to make sure the bladder is fine, and so on and so forth, because you have to do that. Because just because you know the patient has sickle cell trait, they can have microscopic hematuria, that doesn't mean they can't have all these other things. And if you just put that away and you close the case, you got yourself into a lot of trouble, and the patient will be in a lot of trouble. Remember, this is clinical medicine. It's not a science, it's an art form. You always have to connect dots to make sure that you don't miss diagnoses. You don't cause people to have pain and a lot of other associated issues that's not necessary because you didn't pick up the abnormalities early enough. Again, I kept talking about minutia. Minutia is very important. This last year and this year, I have a couple of patients of mine who went for major cardiac surgeries at major, highly reputable medical centers in the general area, in the general New York area. And both 2 or 3 times the people almost died. They almost bled to death. Post-op, requiring several units of blood. Then they wind up coming back to me. I'm the primary care doctor. I'm the hematologist as well. The platelet counts were fine. The coagulation profile were fine. And I had to think through why did these folks bleed so much. There had to be a reason. And you would be shocked to know what I came up with. Both these patients, 2 or 3 of them, wind up having markedly low vitamin C. Something as simple as that. Markedly low vitamin C. Whoever doing, no one is doing vitamin C level. It's not part of what people do every day. But I thought of it. And these people's lives were saved because when I tested the vitamin C, because how did I come up with the idea, the concept? Well, I just told you. The platelet count was fine. All the coagulation things were fine. There was no surgical problem involving things that needed to be sutured or resutured. How come all this blood was lost? They didn't hemolyze the blood. I ruled that out because at a glance, ruled it out. So what was going on? What else in clinical medicine that I came up with that can cause somebody to bleed so much? The only thing I know happened to be low vitamin C. And sure enough, these people's vitamin C level were almost 0. And they almost died because of it. It's simple. You know, people take vitamin C all the time. They don't. Because these are individuals who came from part of the world where this sort of stuff that we eat that have a lot of vitamin C in it is not part of the daily diet. And since vitamin C level is not something that we check routinely, is not part of the standard of practice, no clinical doctor that I know, and I know a lot about them, great doctors, don't every day send somebody's vitamin C level off. And sure enough, that's simple test. That's as simple. I mean, people are abusing vitamin C, taking a gram, 2 grams, gram and a half, so they can talk about it. It's supposed to prevent cold, etc. And patient almost die. Almost die, requiring several units of blood. One guy got 4 units, the other guy got 5 units, and came to me, had to give another 2 units, and only to find out it was vitamin C. Another guy came in with this lesion in his uvula at the emergency room of the hospital up the street there. We were all going, wacko, what's going on? This guy probably has cancer up there, bleeding profusely. Did all this other fancy stuff, sent him to all the fancy specialists. Guess what was wrong? His vitamin C was extremely low. That's why he was bleeding, because vitamin C causes tissue bleeding, not a vessel bleeding, tissue bleeding. Usually from any mucous membrane, the mouth, the nose, and he was bleeding from the uvula. Okay? Had CAT scan, all sorts of stuff, and people get very nervous. It's probably cancer, getting ready to do a biopsy, etc. And then I say, I tell you what, before we do all this fancy stuff, well, let's check his vitamin C level. Within 2 weeks, the stuff, the big clot that was sitting in the uvula was gone. No more bleeding. Okay, that's minutia, right? It is not. It's called medical knowledge. That's what it means. It's not minutia. It is amazing to me. Whenever people don't know something, they like to, oh, this is nothing. Let's push it aside. Oh, this is Val is at it again. This is Val. Val is doing his thing again. Well, Val is saving lives. 7 lives, okay? So the key thing is you must know if you have sickle cell trait. The way you do that, you do a quantitative hemoglobin electrophoresis, not qualitative. Quantitative, it will tell you more. simple test. They use the same tube that you do the complete blood count. They use that to the hemoglobin electrophoresis. You get it back 4 or 5 days. And so you do that. I have people in my office that I'm seeing for the first time in their 70s, early 80s, having sickle cell trait. Okay, nobody knew they had it. And then they're going to pass it on to the rest of the family. Pass it on. They're going to pass it on to their children, their grandchildren, their great-grandchildren. They're going to pass it on, which is catastrophic because these individuals carrying this serious abnormality is penetrating the rest of the family, and they know nothing about it. They know nothing about it. They're just passing it on. Okay, they're just passing it on. So it's an abnormality. You don't go and start having babies all over the place without first screening. You do screening before you have babies, depending on your ethnicity. That's correct. Depending on your ethnicity, there's nothing wrong. You are who you are. And you know certain things can happen, like people who have thalassemia, beta thalassemia. There are countries such as Greece, etc., where the government send people from house to house with portable machine to test for public health reason to see who's carrying beta thalassemia, because it's a very common disease in that population. And then when the kid is born with it, the whole family is upside down. Well, the same thing here. If two people with the sickle cell trait got together and have a child, 25% of chances this child is going to have sickle cell disease. 50% the child is going to have sickle cell trait, and so on and so forth. Those are the breakdown numbers. Well, then it keeps going penetrating. I'm here to tell you, having a baby with sickle cell disease, the whole family is upside down. Because from birth, that baby is sick. Back and forth to the pediatrician, back and forth to the hospital. It is a serious problem. And it can be avoided by people being more careful, by doing screening. And then if you find that you have it, and you also find that your person you're pregnant for has it, then you get in touch with your doctor, will refer you to geneticists. They will tell you what are the chances that the baby is going to have full-blown disease or not. There are ways of telling. And furthermore, up to 6 weeks of pregnancy, you could take amniotic fluid and test it. It will tell you if the baby that the mother is carrying has the sickle cell trait or the sickle cell anemia. Up to 6 weeks, you could do that. Now, they're even able to get actually blood. It is so amazing what they can do nowadays. They actually be able to get blood, not only the amniotic fluid, the technique that they can actually get blood, small amount of blood from the fetus without interfering with the health of the fetus, to test to see if babies are carrying certain abnormalities, including sickle cell disease. Then the parents have an option as to what to do. If they want to have a legal abortion, I'm Catholic. I'm not encouraging people to have abortion, but I'm a physician. I'm a physician. Who am I to prevent people from doing what they feel is good for the upcoming child? Because they're going to have to take care of the child. My job is to do my work and send them to the proper places where they can be properly advised as to what to do. And then they have to make the final decision. But you can't go on and just have babies like that all over the place. And this is why the incidence of sickle cell trait in the black community is so high. 3,600,000. It's getting higher, believe me, it's getting higher, because I have previous books that I've written other than this book where the number was much lower. The number of sickle cell anemia, now it's 100,000. Sickle cell disease, that was lower some 10 years ago as well. I have books that I've written 10 years ago, the number was much lower. So it's getting worse rather than getting better. And it is not necessary. It is not necessary. In New York City now, I believe there's a law for both Spanish and black babies to take blood from the umbilical blood to test at birth whether the baby has sickle cell to it or not. I'm almost sure there's a law. I heard or read about it sometime a few years ago. If I'm wrong, I stand corrected, but that's the case. There's a law in New York City for both Spanish and black kids to test them blood from the umbilical blood at birth to see if they're carrying the abnormality, etc. So, and then of course, as far as treatment is concerned, well, you give them folic acid for the low-grade anemia, 1 milligram twice a day, as opposed to the sickle cell disease where they have 4 milligram 4 times a day, again 1 milligram twice a day, because they have a low-grade hemolysis. Remember, 30 to 35% of their red blood cells are hemolyzing, so that has to be replaced. They don't feel anything. They won't feel anything because the indirect bilirubin that would have caused them to have gallstone, that would have caused them to have a whole bunch of other symptoms like yellowish eyes, sclera, etc. They won't have it because there's a formula which I'll give it to you to put in your back pocket. If the indirect hemoglobin is 4.0, the liver is going to take it out. Up to 4.0 indirect hemoglobin, the human liver is able to clear it out. I thought I would give you that for your back pocket. Up to 4.0, it would clear, the liver will clear it. So, therefore, this individual, if they have the arthritis, you treat them with NSAID for the arthritis, which they likely have. If they have, they will have the low-grade anemia, you give them folic acid. And then, of course, you tell them to be careful. The OBGYN people will tell them to be careful. You go to the geneticist who tell them what to do, etc., etc. It's not to have babies with SS disease. Listen, I'm stopping here. This is show number 12 in this series. Next week I'll find something else to talk about. Until such time, this is Dr. Alcena saying so long and bye-bye.